hospitals. Something weird happened on the way to Medicare Advantage being the new nirvana for healthcare. Hospitals are dumping Medicare Advantage plans. If you have a Medicare Advantage plan and you have to go to the hospital, you might want to call the hospital first and see if they will accept money from your insurance company. Now, if you have real Medicare, you don't have to worry. There's not a hospital in America that doesn't take Medicare. But here's what's going on right now. CEO of Brookings Hospital System in Brookings, South Dakota, Jason Merkley, was one hospital executive willing to speak out about the problems of Advantage plans. This, by the way, is from Wendell Potter's newsletter over on Substack. This is a quote from the CEO of a hospital system, a multi-chain hospital system in South Dakota. Quote, "The difference between original Medicare and Medicare Advantage is vast. Medicare Advantage plans pay less, don't follow medical policy, coverage, billing, and payment rules and procedures, and they are always trying to figure out how to deny payment for services." He said his 49-bed hospital is getting 17% less in reimbursement from Advantage plans than payments from regular Medicare. He said they are slow to approve. They often partially approve or even deny medically necessary services. Sometimes they don't get back to the hospital about whether they'll pay or not until after the patient has been discharged, and then they deny paying for the services that have already been provided. He said, quote, "The hospital spends a lot of time and resources to appeal. We estimate it requires 3 times more labor and expense to collect from Medicare Advantage plans than from traditional Medicare." As a result, they're saying, we're not going to take it anymore. The Nebraska Hospital Association, which represents 92 hospitals in Nebraska, issued a clear warning in a report this fall that Medicare Advantage plans are, quote, "failing patients and jeopardizing Nebraska hospitals." The association noted 2/3 of the state's hospitals now refuse to contract with some Medicare Advantage plans, and 90% say Medicare Advantage plans negatively impact the care they can give. More than 92% of the hospitals say that prior authorization requirements delay necessary care. 3/4 say the cost of complying with plan rules has increased, and 90% reported the experience of working with the plans had gotten worse. The Mayo Clinic in Arizona and Florida have, quote, "always been out of network for Medicare Advantage plans," said a spokesperson. In other words, they don't take Medicare Advantage at all. They take Medicare, not Medicare Advantage. In California, a Scripps Health spokesperson said no individual Advantage plans will be accepted where Scripps clinics and Scripps Coastal Medical Group doctors are in network. Dr. Steve Gordon, the CEO of the St. Charles Health System in Bend, Oregon, said, quote, "Every day I hear stories of Medicare Advantage patients who have trouble getting the care they need." He told the story of a prostate cancer patient who was denied 3 times a PET scan, payment for a PET scan to see if the cancer had spread, quote, "even though the test is nationally accepted best practice care." The hospital will no longer accept Advantage plans sold by Humana, HealthNet, and WellCare.
This is the Thom Hartmann Program.
If you got suckered into Medicare Advantage during this open enrollment period these last few weeks, you might want to look into whether it's too late to back out.